We're rounding out our transplant discussions by expanding our previous panel topic. Transformation unfolds across America's transplant system, but this time with a focus on key issues targeted by current and emerging legislation. Joining us today, we have two very special guests who are no strangers to AAKP. Peggy Tighe, who's a principal at Pyles, Sutter, and Verville, PC, and legal counsel to the American Society of Transplant Surgeons, and Alicia, Hennie, Vice President of External Affairs for the United Network for Organ Sharing. I'd like to begin by welcoming Peggy, who is joining us remotely today. Peggy will share some insights into legislation impacting the transplant community as we move into 2025. Goodness. Peggy, the floor is yours.
Thank you so much, Ed. Today makes me remember how lucky I am, how absolutely lucky I am to have partners like AAKP who have been tried and true for over a decade in working with us in my role as legislative counsel to ASTS, in recognizing that we see eye to eye on every bill we ever look at. We have the exact same lens of how do we help the patients and how do we get it done. I also consider myself lucky to be working with doctors Cooper and Potter, who, what a team, boy, they are absolutely amazing and so good at what they do and such passionate advocates for transplantation and the patients they serve. It's not uncommon for me to be talking to Dr. Potter and Dr. Cooper on a regular basis, and they will say, I've got to run. I'll be right back. I got to do this, thing. What are you doing? I'm putting in a kidney. I'm taking out a kidney. What? I mean, again, it reminds me how lucky I am to be with such talented, faithful, fabulous human beings who do this life-saving work. So what I'd like to talk about today is what is going on with Congress and these pieces of legislation, these bills that we've been talking about today, and why they are so important. The ones we like to support, the ones we don't like so much, to make sure people are understanding what the problems are with those pieces of legislation, and also to talk about modernization efforts and where we go into a new administration. So I'll start by doing, again, the inside baseball on the Living Donor Protection Act. Steve and Matt did a beautiful job of covering this, and Ed earlier had talked as well about the Living Donor Protection Act, but I want to put a finer point on that. We have never been as close to passage of this bill than right now. In the next month, literally a month before December 20th, we have the best shot we've ever had of moving this bill in Congress. Why? Because we have that deal Steve talked about with the insurers. We worked with the insurers for a very long time to make sure we were crafting language that was going to preserve and protect the patients, but ensure that the insurance industry did not oppose us. We got that. And that had a lot to do with AAKP and the experts and the allies they know in the insurance industry. So forever thankful for that. That's incredibly important. We hit a magic number with LDPA just in the last couple of days, and that magic number is 218. That is a majority of the House of Representatives. So we should be able to move a bill when you have a majority of the House of Representatives and a significant number of senators who are supporting this legislation. Those are two of the litmus tests for how a bill becomes a law. Steve also mentioned another one is it should be either very low score to the taxpayers. So the Congressional Budget Office, or the CBO, is the group that determines how much a bill costs the American taxpayers. Living Donor Protection Act costs the American taxpayers $0. It is what we call bipartisan. It is bicameral. It does the right thing. It is clinically backed and researched. That what we know is that people are telling us, potential donors, over and over, I might not do this because I'm worried about my job. I might not do this because what about insurance? So that's what we tackle in the Living Donor Protection Act. We could do it. We can actually do this year if there is a bill that moves at the end of the year. There are some who are saying, why don't we just wrap up Congress and be done with it and just move into the next administration? This is the type of bill that can and should be done, that would also show a bipartisan spirit among Democrats and Republicans that I think this country needs at this very moment. I've said it 100 times, but I'll say it again, and I think I probably stole it from Steve. They've never seen a Republican kidney. They've never seen a Democrat kidney. They don't exist. This should not be a partisan issue. This is something Congress is capable of doing. I also know how a bill does not become a law. A bill does not become a law when you don't work with allies. A bill does not become a law when you don't talk to your opposition. A bill does not become a law when you come up with ideas that aren't clinically backed, that don't have the research behind them, when you're not talking in a survey, an analytical, research-based way to patients, to recipients, to the community to know exactly what is needed to correct the problem. I wish xenotransplant was available tomorrow. I bet all of you do as well. But until that time, let's not risk taking our minority populations, because that's who it's going to be, and give them $50,000 to give away a body part. When perhaps, as Matt's study says, it's unethical for a lot of reasons, but the one that really stuck in my head is, what if your mother or sister or brother needed a kidney and you already gave one away and you were the only match? Boy, is that really what our federal government should be sanctioning? I think not. So LDPA, fight, fight, fight. Please talk to your members of Congress literally in the next month, begging them that this is a bill that they can do. I think that's incredibly important. We've spoken enough, I think, about the End Kidney Deaths Act. We don't think that is the right path going forward, as much as it's very well intentioned. The last bill I want to talk about is Representative Del Benny. Susan Del Benny from Washington State will be introducing a bill the first week of December. This is breaking news, people. I just got it on text from that staffer. What the bill does, which is so important, is it removes the recipient income test. It removes the recipient income test. That was also a barrier to people donating. It also makes donors eligible if they are at or below 700% of the federal poverty line. The original law was 350%. So allowing more people to be donors is also a great idea. The third thing the bill does, which is super important, is the maximum reimbursement is increased up to $10,000, and it's tied to inflation. All of the reimbursement is, as the word suggests, is for things that you were out of pocket for, right? Travel and food and maybe childcare and maybe some other things that you wouldn't have had to pay for if you didn't try to give that gift of life to somebody else. You should be blameless and harmless, but not selling your kidneys and then not having one to give to a family member in need later on. So that's coming. And we really hope that we will work as a community to support that bill going forward. I almost have my official blessing from ASTS, so sorry if I'm speaking too soon, my surgeons. I hope they're going to support this bill. It looks like we probably will. And I think AAKP and our friends at ASN and AST and all the other alphabet soup of our allies will be supporting that bill. So I'm excited about it. It will have to be reintroduced in the next Congress. And when it is reintroduced in the next Congress, we're going to, pardon my French, fight like hell to get it done. And if LDPA doesn't get done this year, we're going to fight like hell to get that one done in the next Congress. Last point I would make is, with a new administration, there's a lot of fear and panic about what a new administration could be doing. This really isn't a new administration. Remember, this administration has been in before. And they had, one of their earlier moves was an executive order on transplantation. And they called for a lot of things that are in process, changing the OPTN system, but retaining what Ronald Reagan called for when he signed this into, signed NOTA into law, a public-private partnership. It has to be a public-private partnership. We cannot have full government control over transplantation. It would be politicized, as both Matt and Steve has said. That is really dangerous. We have to be involved. Patient groups have to be involved. Transplantation associations, societies, and others have to be involved in how our process is changed. And hopefully not, as Steve suggests, his fear is, and my fear is as well, in a plane in the sky changing engines. So we hope you will stand with us to help the new administration build off of where they were when they were the old administration, into the right direction to make sure that ultimately who we're serving are the patients and those who serve them, to ensure that people are comfortable enough and have enough faith in the system to know that they can give the gift of life and that the surgeons are really there for you. And we can get this done together with your help. And with that, I will just end and say, I, again, am lucky. I am lucky to work with you all, and I appreciate you all so very much.
Well, thank you, Peggy. We're lucky to work with you as well, and we look forward to continuing that work for the rest of this Congress and the coming Congress, and work to advance some of the joint efforts that we've covered over the past decade and a half, I guess, which is goodness gracious. Now I'd like to turn to Alicia Hennie, who joins us today to speak to the Organ Donation Referral Improvement Act, H.R. 9939, and how this legislation contributes to the strengthening of the nation's organ donation and transplant system. Alicia.
Great, thank you. Thank you so much for having me today. It's a pleasure to be here. I appreciate working with the AAKP. Their leadership is so critical for kidney patients across the country. And I also appreciate the opportunity to be with an organization that convenes the community from across the entire spectrum, as you've heard so far this morning, because it is a very big community when you think about donation, procurement, transplant, and then post-transplant care for our patients from the UNOS perspective. UNOS is the United Network for Organ Sharing, and we're in Richmond, Virginia. We're a nonprofit, and we have the essential role in establishing the record-breaking performance, the technological innovation, and the global leadership that the transplant system has had over the past decades. UNOS is outspoken in proposing solutions to obstacles that are entirely outside of our purview and control, but also driving continuous improvement in areas it can control. So we are uniquely positioned to help Congress modernize organ donation and transplantation through patient-centric reforms. And as Peggy mentioned, patient-centric is absolutely key when we're on the Hill with legislation. So today I'm going to share more information about one critical reform we're working on with Congress and with the AAKP to advance. And this is an improvement for automated deceased organ donor referral, or H.R. 9939, the Organ Donation Referral Improvement Act. Studies have found a 49% increase in donor referrals and a 333% increase in organ donors upon implementation of an automated deceased donor referral system. 333% is quadruple. One donor can save 8 lives. This is a significant opportunity. Automated electronic deceased organ donor referrals are systems that are used between the hospital and the organ procurement organization. Typically right now, the standard that is across the country is a very busy ICU nurse or a very busy ER nurse having to take the time to make a phone call to manually notify an organ procurement organization of a potential deceased organ donor. These are very busy people in very busy places. And what we have found is that in these studies, the use of these systems has actually saved time for these staff. So what exactly are these systems? Well, they're not standardized at this point. There's various pilots across the country that have employed automated electronic deceased organ donor referral systems. Sometimes these systems are directly linked into a hospital's electronic health record system. Sometimes these systems are separate web-based portals. Sometimes these systems are utilizing the health information exchange available within the region or the state. So there's a lot of different ways that we're seeing the community working to try to make this improvement. And therefore, that is the reason why we need this Organ Donation Referral Improvement Act. The bill is bipartisan. It was introduced just last month by Congressman Whitman of Virginia, Congresswoman McClellan of Virginia, Congresswoman Miller Meeks of Iowa, and Congressman Costa of California. The legislation is supported in total by 22 organizations at this point within the organ donation and transplant community. So just a few key facts about what this legislation would do. This legislation would study the use of these systems across the country and then produce best practices and recommendations to inform broader adoption. There are very important keys included in this study that the Department of Health and Human Services would be tasked with conducting. For example, looking at if what is available actually is helping to reduce busy hospital staff time on manually referring donors, if it is actually increasing donor referrals, increasing the number of organ donors as we have seen in these small studies, and then making best practices, recommendations for how to implement nationally to improve performance. Additionally, the legislation would identify any costs related to installing this sort of a system and any sort of referral best practices that may be included, such as remote access from the organ procurement organization to the hospital. So we're very appreciative of AAKP support for the Organ Donation Referral and Improvement Act, and we ask support with your congressman too to join and co-sponsor this bill. It's very critical to the success for any sort of kidney issue or organ transplantation issue that members of Congress hear from their constituents who are experiencing and a part of this community. So I just wanted to also talk about two other items since I have the mic. Thank you. I wanted to give you all an update. I was here and very privileged to be here earlier this year, and we were able to speak about the upcoming Federal Aviation Administration's Reauthorization Act that had been coming up. Well, that bill has passed into law, passed in May, and it included a provision of a working group led by FAA to get organs back in the cabin and flying with the protective eye of crew, and also the access to full hours for flights, not just cargo hours, as organs are now being flown. This bipartisan provision will require recommendations to be released next year. And I just wanted to really give a kudos to FAA because they have taken on this working group assignment. It's been incredible. I mean, it's just absolutely awesome to see a federal agency come together with a plan to meet deadlines and to make it happen. And they have pulled in all sorts of organizations from across the community, and of course from across the aviation community, so that pilots and flight attendants and airlines know what's going on and are a part of it as well. And just something interesting is that pilots didn't realize that they had been flying kidneys in their cargo holds, and they thought, wait a minute, if I knew about that, could I get life flight status? Could I be ahead of the line here? They were pretty excited about that. So we're really pleased with this provision and how it's being implemented over at the FAA, and thank the AAKP for all of their support in getting that across the finish line this year. And additionally, we've heard a lot about Living Donor Protection Act, and UNOS is a very proud supporter of the Living Donor Protection Act. We've officially endorsed, and when I'm on the Hill having conversations with staff, I'm constantly asking for support. But because of the great work of AAKP and Peggy and ASTS, many of those meetings are just thanking these staff for their members already supporting the bill. I mean, this is such an incredible opportunity that we're at this year, Peggy, and congratulations. What a huge milestone. We're with you all every step of the way.
Well, thank you both very much for your presentations, and we remain very hopeful for the future because of folks like you.